Yes, the arm D is one of the 4 arms that we have in a SEQUOIA study, which is a rather complicated study addressed to frontline patients with CLL. In arm A and B, patients were treated with either zanubrutinib continuous therapy or compared to bendamustine plus rituximab. In arm C, patients with deletion 17p who were not included in arm A and B because of the exposure to chemoimmunotherapy were treated with continuous zanubrutinib monotherapy. While instead in arm D, we tested the combination of zanubrutinib, a BTK inhibitor, with Venetoclax, a BCL2 inhibitor. For patients, initially only for patients with deletion 17p and or p53 mutations, and then we enrolled also all other patients based on the efficacy that we observed. The data that I presented here in Madrid were about the cohort of patients with deletion 17p and or p53 mutation, because that's still a high-risk population, and we don't have much data where the combination between a BTKI and BCL2I has been used. So just in a nutshell, we have at the moment still a short follow-up. It's 2.5 years, but the treatment itself lasts up to 27 months. So a patient can stop the treatment based on undetectable MRD, both in peripheral blood and bone marrow, after at least 1 year of the combination. But that at the moment the follow-up is not enough to see that happening. So, but we can definitely see the responses. So we had 100% response in both, of course, complete remission and partial remission. And we had 59% as the best result in terms of undetectable MRD in the bone marrow of the patient treated with the combination.